FSGS is patterns of glomerular scarring or sclerosis that primarily resulting of podocytopenia. Under hemodynamic stress or due to structural defects, the podocytes first undergo foot processes effacement. Eventually, they lose their grip and detach from the glomerular basement membrane. When these podocytes detach, they leave the GBM exposed to Bowman's capsule. The exposure triggers the formation of a bridge or synechia between the GBM and the capsule. As a result, plasma protein, an extracellular matrix component, become trapped and deposit into the damaged area. This leads to the formation of sclerosis as part of a dysfunctional healing process. Focal, it initially affects only a few glomeruli. Segmental, it involves only a portion, or a segment, of the glomerular tuft. A dangerous compensatory mechanism often follows. As some nephrons are lost to sclerosis, the remaining healthy nephrons undergo hyperfiltration to make up for the loss. This increased workload puts even more stress on the remaining podocytes, making them prone to detachment and leading to further sclerosis. This same mechanism is seen in secondary perihilar FSGS, which can occur after the surgical removal of pathological kidney. Then remaining nephrons are forced into hyperfiltration to handle the body's entire filtration. Patients present with nephrotic syndrome as a result of podocytopenia causes proteinuria and hypoalbuminemia as loss of albumin in urine. Eventually, it affects oncotic pressure of vessels, leads to edema. In cases of perihilar FSGS, patients often present with enephrotic ranged proteinuria without the full clinical constellation of nephrotic syndrome. FSGS is primarily genetic mutation in structural proteins like nephrine NPHS1 gene mutation and podocin NPHS2 gene mutation. Beyond genetics, FSGS is closely linked to circulating permeability factors. These antigens, such as soluble urokinase plasminogen activator receptor, SUPAR, and cardiotrophin-like cytokine factor 1, CLCF1, act as systemic triggers that increase glomerular permeability. FSGS can arise from various secondary causes. It is associated with medications, viral infections, including parvovirus B19, cytomegalovirus, and Epstein-Barr virus. Additionally, systemic conditions like sickle cell anemia can lead to the characteristic segmental scarring of the glomerulus. Hope it helps. Thanks for watching. Subscribe for more.